All right. Hello, everyone. I am Nicole Del Castillo. I'm the director of the Office of Diversity, Equity, and Inclusion here at the Carver College of Medicine. So happy today to have you all joining us for this wonderful talk that we'll have. And I'm going to transition now to Tracy Chen, who is one of the presidents of APAMSA, or the Asian Pacific American Medical Student Association. Go ahead, Tracy.
Hi, so I have the honor of introducing Dr. Chang. So Dr. Kimberly S.G. Chang, MD, MPH, is a family physician and director of human trafficking and healthcare policy at Asian Health Services in Oakland, California. In 2015, Dr. Chang completed the Commonwealth Fund Minority Health Policy Fellowship at Harvard, examining the role of federally qualified health centers in addressing human trafficking. Previously, Dr. Chang was the inaugural clinic director at AHS, Frank Yon Medical Center, and provided care for many commercially sexually exploited children. She trained thousands of frontline multidisciplinary professionals on the human trafficking healthcare intersection, provided invited expert testimony to the U.S. Helsinki Commission on best practices in rescuing trafficking victims, serves on the National Advisory Committee on the Sex Trafficking of Children and Youth in the United States, and co-founded HEO Trafficking. She was elected as the Vice Speaker of the House on the Executive Board of Directors for the National Association of Community Health Centers in 2018, and in December 2021 was announced by the White House as an intended commissioner for the President's Advisory Commission on Asian Americans, Native Hawaiians, and Pacific Islanders. She was nationally recognized with the Physician Advocacy Merit Award from the Institute on Medicine as a Profession and featured in the New York Times, U.S. News and World Report, PBS NewsHour, the Sacramento Bee, and several podcasts. Dr. Chang received her BA from Columbia University, her MD from the University of Hawaii, specialized in family medicine at the University of California, San Francisco, and earned her MPH from the Harvard T.H. Chan School of Public Health, where she was recognized with the 2015 Dr. Fangchi Sam Memorial Award for commitment to promoting the health of vulnerable people. Her most recent awards include the Harvard School of Public Health 2020 Emerging Public Health Professional Award and the 2021 UCSF Alumni Humanitarian Service Award. Thank you so much for coming here to speak with us, Dr. Chang. It is absolutely an honor.
You gotta shorten that bio. Thank you everyone for joining. Should I go ahead and share my screen now, Dr. Del Castillo? Yes, okay, here we go. All right, can you see that? Let me put it on. All right, so thank you everyone for joining. I have a lot of content here, and I really do appreciate you all for being here, because you could be doing anything else, like preparing for your lecture this afternoon, doing your regular work, getting things done, and I just want to appreciate you for being here and listening and being interested in this topic. So I'm going to talk about human trafficking in healthcare and what's our role beyond our clinic and hospital walls. This is really important because human trafficking doesn't exist in isolation, and it's not specifically a medical disease per se. So to save you all the time, in case you need to leave early, I'm just going to give you the take-home point right away, right off the bat. And the take-home point is that we must be advocates for policies that increase access to systems of care and protection. And I'm going to elaborate on that a little bit. What does it mean to be in a system of care and protection? What does it mean to have access to that? What does it mean when we talk about policies? All right, so first, self-care is very important. This is a heavy, traumatic topic. There's a lot of things that could could make folks feel uncomfortable, or trigger them in if they've had experiences of some of the things that we talk about. So please feel free to take care of yourself, step away, hydrate, breathe, and connect with your environment itself. Take care of yourself. I won't be offended if the audience count goes down. It's fine. And this is being recorded, so you can come back to it later. All right, so let's get started. I've been raped 2 times. Then I've been tortured by 2 guys in 2 days. These are the words of a patient of mine who understood her role and her place in this world. So I'm tired. Girls dying, people catching AIDS. So I don't want to be doing it because that can be me. These are the words of a patient of mine who understood what her future holds. It's like if you die, get murdered or something, all it is they have another girl taking their place. That's all it is. These are the words of a patient of mine who understood how much her life mattered. So let me ask you this. How many of you, and you can write it in the chat. I can't really see the chat. So maybe Dr. Del Castillo can read it out if there's anything you find interesting in the chats. How many of you ever, and raise your hand, how many of you have ever known someone who's been a victim of human trafficking, who's been human trafficked? Let me try and extend this screen so I can see it. Aline, thank you. I see your hand. It popped up at the top. Shannon, thanks. Katie, thanks for sharing. So three of you have known someone who's a victim of human trafficking. Okay. So victims of human trafficking span all racial and ethnic boundaries, gender, age. They're invisible, they're hidden from us, but sometimes they're right in front of us in plain sight. They can be cooks in our restaurants, people who grow our food, they staff our factories, they're children, sometimes they're nurses or doctors. They are our community and our patients, and yet we don't see them. So what is human trafficking? In the chat box, feel free to type out what you think is human trafficking. Let's see, I can see this. Anyone want to type in anything in the chat box? Okay, I'll just go ahead. You see the title here. So in 2000, Congress passed legislation legally defining what human trafficking is. So the definitions of the Victims of Trafficking and Violence Protection Act, it's the TVPA, has been reauthorized 4 times, and the definitions are basically sex trafficking or severe forms of trafficking in persons, sex trafficking, which is a commercial sex act induced through force, fraud, or coercion, or a commercial sex act in which the person induced to perform that act hasn't yet turned 18 years old. It is also labor trafficking, which is the recruitment, harboring, transportation, provision, or obtaining of a person for labor or services through force, fraud, or coercion. For these purposes, involuntary servitude, peonage, debt bondage, or slavery. So this is the criminal definition of human trafficking. This is how it's defined in our laws and our federal law. But let me submit this to you. Human trafficking is defined as a crime. So it's really under the jurisdiction, under the responsibility, under the authority of the criminal justice system. So why is it that I'm here as a doctor talking to you about human trafficking? Well, you can see that we have sometimes share the same goals. We want to heal our patients. We want to help our patients who sometimes are victims. And the criminal justice system wants to prosecute traffickers. In best cases, we overlap in our goals. But sometimes we have to recognize that our systems are different. And sometimes the systems are at odds with each other. And so you can see that with different goals and different mindsets of how to approach the problem, we need to have a strong healthcare and public health system in order to also address this issue. Can we arrest and prosecute our way out of this problem? I don't think so. I mean, think about it. How many of you have ever been a victim of a crime? Your car is broken into, theft, hopefully nothing really severe, but possibly assault or something like that. How many of you have actually been a victim of crime and had that taken all the way to access to the criminal court system and got protections and remediation that way? Very few, right? So we know that only a small minority of those trafficked get access to criminal justice systems of care and protection. And then we know that for us in healthcare, we're seeing patients who are being exploited, abused, and traumatized. And so in healthcare, in our system, we focus on the patient's experiences through exploitation. We are not criminal justice investigators. We are not intended to or expected to make the determination of human trafficking. I'm not trained how to decide whether something is a crime or not. And again, human trafficking is criminally defined. So what we should do then is focus on exploitation and the experiences of our patients, and really focus on that, treat that, make sure our patients can get healing and resources and services. And you can also see that in our international classification of diseases, the ICD-10 codes, which we use in healthcare to code all of our diseases, symptoms, abnormal findings, social circumstances, and external causes of illness and injury, you know, when we do our billing sheets, when we see patients, you can see that the codes for human trafficking, which were just released about 3-4 years ago, they don't say human trafficking, they say exploitation. So that's what we're looking for. That's what we're looking for. That's what we're coding for. That's what we're tracking on a populational health level in order to inform health policy and resource allocation. All right, so I just want to emphasize that point. In healthcare, we're looking broader. We're not looking just at a crime. We're not looking just at what are the remedies can we have for law enforcement or criminal justice. We're looking at, hey, let's look at our whole patient and how do we get them treatment, services, resources. So what exactly is exploitation? So we have to add this in. You know, labor exploitation is a broader term. It's not a legal term, but it's basically when an employer unfairly benefits from an employee's work. It's not all forms of labor exploitation are illegal, but we know as healthcare providers that when patients are exploited through labor, they can have health harms or health effects or health presentations. Labor violations is a subset of that. It's a legal term when employers violate federal, state, and municipal laws related to, for example, workplace safety or record-keeping requirements or misclassification of employees. So broader, go broader when you're thinking in healthcare. For sexual exploitation, we can think about it as a subset of the whole universe of sexual violence, which includes rape, sexual assault, harassment, child sexual assault and abuse, these sorts of bigger picture. Sexual exploitation is a subset of sexual violence. And then sex trafficking is a subset of that. Just to make the point that there are harms, there are medical, physical, mental health, and social harms from exploitation and human trafficking. We categorize them just like any other social determinant of health in medical, mental health, and social harms. I'm not going to belabor this issue, but I just wanted to emphasize to you that we are seeing patients who are exploited, who are trafficked, and these are some of the ways in which they can present into our clinics and our hospital systems. So let me ask you this question now. How many of you have ever known someone who's been exploited? You can raise your hands on this one. We've had 3 people who said they knew someone who was who had been trafficked, but how many of you have seen a patient or knew someone who is exploited, whether for labor or sex? So you see a lot. 2 more hands going up, 3 more hands going up. I mean, I think we probably all know people who have been exploited, whether for labor or sex. Okay, so who is, and this one I do want you to write into the chat box, who is vulnerable to human trafficking and exploitation? Who do you think? I'll give you a hint. What kinds of populations? Who's invisible or harder to see? Let me see if I can get this chat. Oops. Sorry, I was clicking the thing. Okay, great. So now I got this chat box here. People with disabilities, undocumented people, immigrants, the homeless, refugees, everyone in the right circumstances. Yes, and correct. All right, so who's invisible or harder to see? So let's go forward. So this is not an exhaustive list, but these are, you know, some sorts of folks populationally who have higher vulnerabilities to being trafficked or exploited. So, I want to thank Dr. Del Castillo for inviting me. She's the Director of Diversity, Equity, and Inclusion. And I really respect her work and all of the things that she is doing to raise up the issue of inclusion. But to burst your bubble a little bit, I want to tell you, I don't want to talk about inclusion right now. I want to talk about exclusion, okay? Because exclusion is really how these people, how people and populations are vulnerable to being trafficked or exploited. So who gets access to systems of care and protection? We can talk about the people who are included or in the in-group, the dominant majority, and then we can talk about those who are excluded or the out-group who are in the minority. In whatever way you define minority, those are the people who don't get access to systems of care and protection. So let's go back to this slide. I wanted to correct it. I was reviewing this. I spent a lot of time redoing this slide deck and making some new content. I was really thinking about it. And it's not who is vulnerable to human trafficking and exploitation. It really is who is made vulnerable to human trafficking and exploitation, and who is made invisible, and who is made harder to see. Because really, these are policy choices. These are choices of resource allocation. These are choices, public choices of who gets prioritized and what issues and people get prioritized in our society. It's not anything intrinsic about being an immigrant. It's not anything intrinsic being a person of color. It's not anything intrinsic for a youth who is no longer living in a safe, stable home environment. It's nothing intrinsic about being homeless or unsheltered, right? It's nothing intrinsic about having different sexual orientations. It's policy choices. So how are people being made vulnerable to being exploited? How do we as a society create vulnerabilities for people? And what are the historical roots of human trafficking? Okay, this is another chat box exercise. What are the historical roots of human trafficking? There's actually a whole textbook on it. Oh, shoot, I blurred my background so you can't see it, but you see it here. So there's a whole textbook. I wrote a chapter in here with a co-author, and there's a whole textbook. It's really interesting, and it's a lot of history. So let me ask you this: what are the roots of human trafficking? Anyone in the chat box? Let me see if I can pull that box back up again. I don't know how to get that.
And I can read if anybody.
Okay, I don't think anyone's chatted anything yet.
Yeah.
Okay.
Capitalism.
Ah, who wrote that?
Is it
Ben?
Ben?
Right. Thanks,
Yeah.
Ben. Capitalism. Well, Ben, you are
Slavery.
So
Slavery.
Slavery.
Tracy just shared.
Uh-huh. So yeah, so I would say the isms and phobias create conditions for vulnerability and precarity through policy and practice. So what exactly is precarity? Precarity is actually a political notion. It's a political notion that people who are made vulnerable have less valuable, have less value ascribed to their lives. And so they're made vulnerable through policy and practice. And so the isms, so, I think maybe Dr. Del Castillo gave you my slide deck in advance, because you're right, capitalism, racism, xenophobia or anti-immigrant sentiment, sexism, homo or transphobia. These are just a few of the ways in which there are historical roots of human trafficking and exploitation. So let's get back into the theme of this week, Dr. Martin Luther King Jr. and your Human Rights Week. Whatever affects one directly affects all indirectly. We can see that, with capitalism, the drive for maximizing profit and the profit motive at the expense of people really has affected everyone in our society. So, the richest billionaires in our country making billions more during this pandemic, when the essential workers are barely able to make ends meet. So whatever affects one directly affects all indirectly. Capitalism is a driving force throughout history, separating humans and our humanity from the labor or the work we produce through our systems of US imperialist expansion, dispossession of indigenous people, exploitation and slavery shaped the economic climate. And I'd really say the values of our nation, our geographic growth, and it laid the foundation for countless modern institutions, including education, including medicine. The commodification of human beings for profit, that we as human beings are expendable, that we're replaceable, that there's more of us so we can be replaced. Think back to the third quote in the beginning from my patient. They'll just have another girl taking my place. That's all it is. If I die, get murdered or something, they'll have another girl taking my place. That's all it is. She knew it. She knew it at her basic core, what this was all about. So what is modern day capitalism and exploitation? What does that look like? Well, it kind of looks like this: work visas, workers with lesser rights and benefits, the prison industries, for prisoners, inmates, incarcerated folks being made to labor and produce things for the economy at cents for, really the pay wages are so low. It's not even a wage, really. It's just kind of incentive for them to have something to do. But the companies making profit off of those prison industries. And then gig workers. Why do we call them gig workers? They're just workers, right? So calling them and classifying them as gig workers is a way in our minds to say that they don't have value for benefits and social support networks. Even the term human resources, as if human beings are commodities to be used up. And then I brought up earlier, essential workers. Essential for whom? Whose lives are to be risked, made precarious in service of capitalism, in service of profit motive. So this is just an article a couple of days ago. The companies like Uber, Lyft, and DoorDash don't pay into Social Security for workers who they don't consider employees. So there's really no way of getting ahead or having stability and security for their future. And then let's look at the agricultural industry, the modern day agricultural industry. If we look at the USDA, which sort of monitors the industry, look at labor, what it's classified as. It's classified as a commodity. It's right there, laid plain right on the U.S. government's website, and as an expense, right? So let's look at child labor. Let's look at also child labor. Here's from you folks at the University of Iowa, child labor, right? Look at the minimum age for employment in agricultural employment, 10 or 11 years old. Look at the minimum age for hazardous employment in agricultural and non-agricultural employment, 16 versus 18. And then let me ask you this: who does the agricultural work, the field work in this country? Who does it? Let's see. So we
vulnerable
got
people, migrants, minorities, migrant workers, immigrants, undocumented immigrants, mostly non-white folks.
Yeah, and I think that's true, right? That's a fact, right? We have migrant farm workers. There's a huge problem right now because lots of farms can't get migrant farm workers to come do their seasonal planting or harvesting and tending to the fields. It's true. And so whose lives are made precarious for minimum age of hazardous employment, right? And look, here's your Iowa child labor law. Minimum age for hazardous employment, none. So, it's just something to think about. I'm not an economist, so I don't have the solutions for this, but as a doctor, as somebody who sees patients, who knows that there are harms, health harms, and for our patients who are minoritized and vulnerable, made vulnerable, we have to think about this. Okay, just an example of a patient of mine with labor exploitation. So OT was a 20-something, late 20s G1, so her first pregnancy, Burmese immigrant, refugee actually, and she was in her first pregnancy and she had a really severe morning sickness. She was throwing up all the time. She couldn't keep anything down. And so she's coming into the clinic and I had to just keep giving her intravenous fluids like every 2 or 3 days because she gets so dizzy she couldn't keep anything down and just really feeling horrible. She couldn't work. She worked at a local restaurant. And so I wrote her a note, hey, she can't work. Give her time off because she can't work. She comes back distraught the next time for IV fluids and saying, oh, my boss is mad. He says if I can't work, he's going to fire me. I said, oh, what? You're pregnant. That's not allowed here in this country. You have some protections as a pregnant woman for your job. And so let me write him another letter. So I wrote her another letter, took it to her employer. She comes back the next time. Now he's really mad. He's really mad. And he says he's going to fire me, my husband, my brother-in-law, and all the Chin, that's an ethnic group in Burma, all the Chin employees at the restaurant. Okay, so I was like, whoa. So, labor exploitation. We got her involved with our case manager at the clinic, and then she got involved with the medical legal partnership, civil legal services, and they resolved her issue. Fast forward to like 5 years later, when I was in my fellowship, we find out that this particular restaurant chain has been cited for a lot of labor violations and a lot of, worker mistreatment, wage theft, withholdings, all these different kinds of labor violations, and had been fined. So, an example of how a patient could present with labor exploitation. So now let's move to racism. So we know that there's no biological basis for the classification of people based on race, that race is a social construct. We also know that racism constructs. It constructs social institutions, policies, practices, and systems. And we know that capitalism in its earliest forms were inextricably intertwined with racism, dehumanizing and commodifying people of color and socially categorizing people based on color gave cover and excuse for violence, exploitation, abuse, trauma, chattel slavery, and the colonialism and imperialism of European-centric white people over peoples in Africa, Asia, the Americas, Oceania, Pacific Islands. The lasting legacy of the earliest colonialism and capitalistic instincts laid the foundation for these persistent and devastating policies and practices, which inherently excluded people of color from capital, wealth generation, and systems of care and protection. So here's your redlining map from Des Moines, Iowa. It existed all over the country. We think about restrictive housing covenants where people of color were not able to buy property or live in certain neighborhoods. Some of those covenants still exist as titles for properties are exchanged. Discriminatory bank lending, forced boarding schools, Jim Crow and segregationist laws, Japanese internment camps, selective application of eminent domain in the construction of urbanization projects. So all of these things are ways that policy, whether intentionally, a lot of the times intentionally, sometimes as a consequence, but all of these policies have excluded people of color. So don't just take it from me. Here's July 1st, 2021 from the U.S. Department of State fact sheet, which acknowledges the historical and ongoing harm, the connections between systemic racism and human trafficking. Don't just take it from me. Your federal government is saying this as well. And, here's some of the lines in it. And I was just laughing when I made this presentation because I was like highlighting the text, and I realized that this is exactly what all my medical school textbooks look like. Everything was highlighted. So forgive me. But basically, human traffickers disproportionately target those in positions of socioeconomic or political vulnerability due to discriminatory policies, who are often people of color or part of a racial minority. Here in our second paragraph. Discriminatory government policies and private practices that create disparities in access to economic means or opportunities, which traffickers exploit to compel victims in sex trafficking or forced labor. Predatory and exclusionary policies that keep certain racial communities from attaining financial stability and building generational wealth provide traffickers ample opportunity to offer tempting alternatives. Redlining, lending discrimination, unequal distribution of government subsidies and services, restricted entry into white-collar or higher-paying jobs, and intentional exclusions of certain professions from worker protections. I mean, you don't need me to talk. You can just read this fact sheet. but please, I'll keep talking. Please listen still. All right, so racism, continuing on. U.S. law enforcement disparities, incarceration disparities, disproportionate discipline of youth of color in public education, media portrayals, and the public perception of Black, Indigenous, and people of color youth, the lasting legacies. And I added this 2 days ago, continued voting rights suppression. How do we exclude people from participating fully in our society? Here's an example of a patient. I'm just giving you examples of patients who came in with trafficking or exploitation. So he's an 18-year-old, a mixed race boy, youth, I guess, transitional age youth. He's 18, so he's considered technically an adult, but he was half African-American, half Vietnamese American. His father was a Vietnamese immigrant and his mother was African-American, but he was a foster youth because both of his parents had died. I don't know the circumstances, but both of his parents had died. He was a foster youth from age like 15. And then now he's 18, he's transitional age and he's homeless. He has nowhere to go. And he's coming into the clinic. He's okay. He's actually well, but we're doing our history. And I asked him about, trading sex or forced sex or different things like that. And he basically told me, yeah, I did it because she bought me some video games I wanted. So an adult woman had basically sexually exploited this young boy. And this was when he was younger. He was 18 now. He's telling me about his history. And I just bring this up because he's 18. He looks like a man, but he's still developmentally, and Dr. Del Castillo can as a psychiatrist, child and adult psychiatrist, he'll tell you, look, he's talking about video games and he's still developmentally this little boy. And the circumstances of him being in foster care, transitional age youth, now homeless, because that's where they cut off at that time, the support services, and just really being so marginalized and isolated in our community. So that was DH. Okay, let's move to xenophobia and immigration. So just as capitalism and racism are inextricably intertwined, so too are racism and exclusionary and basically immigration policy. Immigration policy in its history was formed as a basis for exclusion. Even look at the terms that we use. They're not human beings, they're not people. There are all these other things: resident alien, not qualified alien, immigrant, non-immigrant, asylee, refugee, qualified alien, some historical terms, nationals or aliens ineligible for citizenship. So historically, exclusionary immigration policies are rooted in racial animus. The immigration policies explicitly sought to prevent migrant peoples of color from entering America, but also to limit their full limit their access to full or partial rights if and once they arrived. This racialization rendered migrant workers of color doubly vulnerable to commodification and exploitation. It separated them ideologically from the labor they produced. Again, they were just vessels for labor versus a full human being. It separated immigrants ideologically from the labor they produced, and it also denied them claims to social membership. You can be here physically to produce this labor, but you're not a member of our society or our community. So you know, immigration, that's what it does. Immigration policies create differential classes of people with differential access to systems of care and protection. That's it, right? A system based on exclusion. And then when you think about immigration, historically and in the modern day, immigrants are needed for labor. So I'm going to talk a little bit. And so again, getting back to our theme, whatever affects one directly affects all indirectly. And in the next 2 lines of this letter from Birmingham jail, Dr. Martin Luther King Jr. wrote, "Never again can we afford to live with the narrow provincial outside agitator idea. Anyone who lives inside the United States can never be considered an outsider." You know, he's really speaking to the fullness of community and the fullness of society, right? So, but when we create these different classes of people who have differential access to systems of care and protection and rights and benefits and things like that, we really limit the full participation of people who are our neighbors and our community members. So let me just give you a historical overview of immigration, exclusionary immigration policies. So the very first legislation on immigration that closed the borders of the United States, that closed the previously open borders of the United States, was enacted in 1875, and it was called the Page Act. This act, Oriental women from immigrating to America because they were alleged to be prostituted women. And really, this was just a backlash against the Asian labor that was brought in to replace slavery, right? When slavery was outlawed, then people with capital needed laborers. So they would bring in, you know, Chinese folks to replace slavery. And again, this is the drive for cheap and abundant and replaceable labor. And the way family formation and social membership was denied to Chinese laborer men. They didn't want Asian women coming in, Oriental women coming into the United States, because they didn't want these Asian Chinese men laborers creating families, right? And so as I go through this section, you can think about the parallels to today's immigration policies as it pertains to the Latinx communities, because it's being repeated. It's being repeated. All of these exclusionary immigration policies are being repeated, and now targeted and focused on the Latinx community. So in 1875, Asian Oriental women excluded. 1882, the Chinese Exclusion Act was passed to prevent all Chinese from coming into the United States. So 1882, Chinese were excluded. In 1888 to 1892, there were restrictions on Chinese. First, this is the first time the United States government uses photo identification to track people. And all Chinese people were required to have these photo IDs and these certificates on their persons at every time, whenever they're going throughout their life while they're in America. And so this is the people who are here were then restricted already, not just from coming in, but people already here working, living their lives, contributing to society were restricted. Okay, so then in 1892, the Geary Act was a legislation that was passed to extend the original 1882 Chinese Exclusion Act. And this 1892 Geary Act, not only did it extend the original Chinese Exclusion Act, it authorized the detention and up to a year of hard labor for any Chinese caught without documentation. So slavery by another name, maybe. So that went to court, and while the Supreme Court later ruled the forced labor unconstitutional, it authorized the detention, which then established the precedent and the basis for incarcerating migrants pending their deportation, declaring that it was not imprisonment in a legal sense. So this practice continues to this day in the 21st century with the detention of migrants and their families at the southern border. 1907 to 1908, let's talk about the Japanese. Japanese was imperial. It was getting a lot of power. And so they didn't want to risk having a war. So they said, okay, well, they made a gentleman's agreement in the background diplomatically, and the Japanese were sort of okay for now to come in and be in the United States. And then 1917 happened. So 1917 happened, and a new Immigration Act was passed. The 1917 Immigration Act created the Asiatic Barred Zone. So you can see everything outlined here in purple was areas that were not allowed, people from these areas were not allowed to come into the United States. So basically that's all of Asia. And this carve out here in yellow, that's the Philippines. The Philippines was a United States colony at the time. So those folks could pass into the United States, but they weren't allowed to become citizens. So they were given another term called nationals. So they could be present in the United States, but they could not ever become citizens. So nationals was another category that was made because that was a colony of the United States. All right, so here we go. Basically all of the rest of Asia excluded. 1924, the Immigration Act of 1924, also known as the Johnson-Reed Act. Federal law then said, okay, forget you, Japan and Korea, we're going to exclude you too. And then in 1933, the Philippines gained their independence. And so, boom, right away, they're excluded. They're no longer can pass through. They're no longer these nationals categories. They're just excluded, period. And then what happens in 1942? Even American citizens, Japanese American citizens, put into internment camps and excluded. So, I bring this up not to say that this is, what's causing human trafficking right now, but it creates the cultural perceptions and biases and ideas about people who look different, right? So let me tell you about a patient, SC. SC was a Chinese immigrant woman who actually was sex trafficked. She had an open case in a county south of mine. She was going through the legal process and working with the prosecutors and investigators to hold the traffickers accountable. But I got a call from the social service agency. Can you see her in your clinic? Because down here in my county, she actually resides in your county. So her insurance says that she has to see medical doctors in your county, even though she was trafficked here in Santa Clara County. So look at these barriers of how we're treating people, based on geography and health insurance. Anyway, so I said, yes, I'll see her. And I said, is there anything going on with her medically right now that we need to take care of? And they said, well, and this is the case manager, the caseworker. Well, I don't think so. She seems okay, but I just know she might need some nutrition counseling, because when I go into her apartment, all she has is ramen noodles stacked up to the ceiling. And she tells me that's all she eats. She won't eat anything else because she is afraid that everyone is trying to poison her. And so, that was her presentation for me. And it could be true. It could be traffickers are trying to poison her, or it could be that there was a lot of trauma, complex trauma, some paranoia, some delusions, some things going on. It could also be that, she had been coerced into using drugs and then had developed a substance use disorder. And so it could also be some of that going on as well. But anyway, just an example of a Chinese immigrant woman who was being sex trafficked in California that came into my clinic. So let's talk about sexism. So sexism, I just gave you an example of SZ. And so sexism, let's just jump into it. What happened in March? There was a big shooting in Atlanta of spa workers. 6 of the 8 people who were murdered were Asian, and they were spa workers, massage workers. And this is just an article from USA Today. Experts say following an antiquated playbook, meaning looking just at criminal justice, does little to protect women often exploited by a billion-dollar industry propelled by a toxic mix of racism, misogyny, and fetishization. Arresting low-level female workers, they say, further stigmatizes a population at risk of violence and trafficking. And then let's read what the suspect said. The suspect told law enforcement officials he had frequented 2 of the spas, describing them as temptations for his sex addiction that he needed to eliminate. And so, you know, I go back to the Page Act and the 1875 Page Act, which policy-wise asserted that all Oriental women coming into the United States at that time were prostitutes or prostituted women. And, you know, those kinds of ideas have been perpetuated throughout history in the United States since that time. And this is an example, I think, of how some of that manifests in exploitation and trafficking today. But sexism doesn't just create vulnerabilities for women and girls. It creates vulnerabilities for all genders. But for women and girls, you know, less unequal pay, less advancement opportunities, less financial independence, less ability to not be dependent on somebody else. The politicization of women and girls' bodies, politicization and media portrayals of women's sexuality, and disparate criminal justice responses to sexual violence. You read a lot about in the media about domestic violence survivors who protecting themselves from their abusers who then get thrown into prison. And yet there's a lot of domestic violence abusers who don't get any, aren't held accountable at all. For men and boys, these kinds of gender stereotypes and biases obscure and invisibilize the male victims and survivors of sexual violence, exploitation, and human trafficking. It also, in some ways, creates barriers for men and boys to seek healthcare and help because of these biases, cultural stereotypes. And so it harms men and boys as well. And then for non-binary or trans folks, you know, you look at the epidemic of trans people of color who are being murdered right now, and they're invisibilized and targeted oftentimes. So this kind of sexism, what affects one directly affects all indirectly, right? It affects all of us. And so let me tell you about BK. BK is, I know I only have 11 minutes. I think I'm good on time. So BK was a 15-year-old Cambodian American girl who came to see me in the teen clinic one night in 2008. This is a long time ago. She came to the clinic very sick. She was young, she was about 15. She had a high fever, rashes all over her body, swollen, painful joints. She had lost 30 pounds in 3 months, and she needed to go to the hospital. We knew she was being exploited in Oakland because she would come in and out of the clinic. And so she was definitely being commercially sexually exploited. We knew this. And when I told her that she needed to go to the hospital this night because she really looked toxic, she absolutely refused. And she told me, so this is BK, she told me, I'd rather die than go back to jail. I'd rather die than go back to jail. On a previous hospitalization, BK was discharged to the county jail because there was a judge's bench warrant for her arrest for failing to show up to court on charges of solicitation or prostitution. She's 15, right? And she was arrested for solicitation and prostitution when she didn't go back to the court for that charge. The judge issued a bench warrant. So then she went to the hospital. Later, she went to the hospital for miscarriage, and she was thrown into jail from the hospital. Suffice it to say, this night when I saw her in the teen clinic, she did not go to the ER. So, you know, she was really a big turning point in my career, because that's when I started to do a lot more advocacy, policy advocacy, and speaking up on behalf of our patients, because I thought, wow, you know, she was going to die that night. Okay, so what, you guys want to hear about what happened to her? Yeah, you do, right? Okay, so you have to wait to the end. Okay, so so let's just go through this last big category for homophobia and transphobia. You know, it was only in 1973 when the DSM removed homosexuality as a mental health disorder, and the World Health Organization only removed it as a mental health disorder in 1992. Homosexual acts were criminalized in the United States until 2003. And even now, today, there's continued systemic oppression of this group of people in areas of adoption, military participation, health insurance support for gender affirmation, and denial of government-issued identification. This still goes on, and this puts people, especially our LGBTQIA youth, at high risk if they're, you know, estranged from their family and community because of who they are, of who they love, of their sexual orientation. Okay. So again, whatever affects one directly affects all indirectly. And in the paragraph above, you know, Dr. Martin Luther King, actually it's the same paragraph, the sentences above, he says, he's cognizant of the interrelatedness of all communities and states, and that he should be concerned anywhere there is injustice, and that we are all connected together in some way. He says, an inescapable network of mutuality tied in a single garment of destiny. So really, what this full paragraph surrounding your thematic quote for this week, whatever affects one directly affects all indirectly, really what it is to me, it's a call to action, a call to you, a call to me, to the readers, to you listeners, to advocate, to activate, and to organize, to correct these injustices, that we cannot just be the provincial or considered to be a provincial outside agitator idea. And I interpret that to say we don't just stay in our medical healthcare lanes. We don't just treat medical disease. We advocate, because all of those lanes affect people and their health. So policy can be a weapon or it can be a salve. Let's make it be a salve. And this is what we do. This is what we should be doing in our role as professional leaders and doctors and healthcare folks and social services. You know, we want to take care of our patients at all of these different levels through all of these different ways: community engagement, our high quality services, clinical services, our social services, our advocacy, or legal services, our advocacy, our population health, and do it from the grassroots to the city level, state, and federal level. And it's not about just striving for health equity. It's about striving for equity, period. If we strive for equity, health equity will go along with that. Don't just stay in your lane. Don't just be an outside agitator. So BK, you want to find out what happened to her. So she didn't go to the hospital that night. She actually went, but called her mom, who is a Cambodian refugee. Her mom said, was afraid and said, don't go. I don't want you to go to jail. Don't go. So the next day, I called the hospital. She didn't go. Next day, our case managers, our health advocates, our community outreach specialists, youth program folks violated HIPAA, called everyone they knew who knew her, said, where is she? They found out where she was, drove to her, talked to her, convinced her, persuaded her. She was really sick, took her to the hospital. She was admitted for like 2 months. She survived. On survival, upon discharge, she was discharged to county jail. Okay, so that is a bad ending. However, what I'm going to say in terms of policy, since her time, what we have done in California and other states around the country have done is we have now made commercial sexual exploitation of children we have in legislation, we have made it as child abuse. That's the first legislation that passed. Then we said that you cannot prosecute, so safe harbor laws, you cannot prosecute or jail or arrest any youth who is being commercially sexually exploited. You can't arrest them for, prostitution or solicitation. That's the second legislation. And then third legislation that said the Child Welfare Department has authority and responsibility for taking these cases. So no longer is it going to law enforcement, it's going to child welfare. So that's happened in the state of California and in states around the country. Not every single state yet, but states around the country. I'm not sure about Iowa. I think Iowa might be a safe harbor. I don't know. Maybe you can figure that out later. And so other things that have happened, we now have these ICD-10 codes so that healthcare can kind of track on a populational level. We have the Health Partners on Intimate Partner Violence and Human Trafficking, which is a national training and technical assistance center for healthcare, community health centers to start addressing this work. This is a lot of the advocacy that I had been doing. And we have these measures in community health centers called UDS. It's called Uniform Data System. And that's measures that we as community health centers have to provide to the federal government on exploitation and intimate partner violence. So they're also looking at this issue from a healthcare standpoint. There's been a lot more awareness. There's been a lot of organizing on the ground, a lot more survivor voices coming to the top. So there is change. And so, when Dr. Martin Luther King Jr. says the arc of the moral universe is long, but it bends towards justice. It bends towards justice. Why? Because of you, because of me, because of our organizing and the work that we do as advocates. So again, our take-home point, we must be advocates for policies that increase access to systems of care and protection. And with the power of advocacy and community organizing, we can take that exclusion and equity and make it inclusion and equity. And then that's my mom and grandma. I think they're cool. So just keep on keeping on. And that's really all I have to say. I can't believe I made it with 1 minute. Here's my contact information. Feel free to reach out. I can give Dr. Del Castillo a PDF of this, but it might look all jumbled because there's a lot of animations overlapping. So I don't know how you want to do that. But anyway, that's it. Thank you for listening. Appreciate your time. And thank you for all that you do.
There are lots of thank yous in the chat coming through. Yes, feel free to reach out to me if you all have any follow-up questions. I'll put my email as well in the chat, as well as Dr. Chang's email, as you all see show up there. So thank you all so much for participating. This is recorded, so we should have this on our website at some point soon in the next couple of weeks. So if you're looking for that too, please feel free to reach out. So thank you all.
So we have another one in 15.
Yep, you got a little break. It's a different link.
Oh, okay. Sounds good. So yeah, I'll try to get that fact sheet. Let me see if